I'm Michael, I'm a chiropractor, and in this video I'm going to be reacting to some videos on low back pain. Do you think I need an x-ray for my low back pain? Was there any trauma? Nope. Neurologic deficits? Nope. Fever? Mm-mm. History of cancer? Nope. Then I don't think an x-ray is necessary because we're not dealing with a serious pathology. So this video was actually really good. It went through a bunch of the indications why you would get imaging for somebody presenting with low back pain. And if the answer was no to all of them and you're not suspecting any serious pathology, then x-rays aren't indicated. That was a great video. Generally, we don't recommend bed rest for low back pain, and that's because we know that exercise can be helpful in decreasing pain, so we try to encourage people to be as active as they can. So that was actually another great video. All the clinical practice guidelines recommend trying to stay as active as you can be when you're experiencing low back pain because it helps with the recovery process. So that was another great video that is recommending the same things as the clinical practice guidelines. What does the research currently recommend for the treatment of low back pain? Well, for acute low back pain, it currently recommends these treatments. And then for chronic low back pain, it recommends all of these treatments. And as you can see, there's a lot of different treatment options for the treatment of either acute or chronic low back pain. Again, another great video. All of those treatment recommendations have been recommended by the clinical practice guidelines. There's obviously a lot of different treatments available, and there's a lot of variability on how people react, so it just gives us a lot of options to choose from that have been shown to be effective options for the treatment of either acute or chronic low back pain. So again, that's just a great video conveying all the information on the clinical practice guidelines. Okay, so obviously I'm a little bit biased because all of those videos were of me, but a recent research article looked at YouTube videos that were on low back pain, and if those recommendations were based on the clinical practice guidelines. And so the research article looked at 17 different categories, and to be considered an evidence-based video, all they had to do was include one of those recommendations in the video. And the study, which included the top 200 videos on low back pain, found that only 50% of them were considered evidence-based. And of all those that were considered evidence-based, most of them just included exercise therapy for the treatment of chronic low back pain. The study didn't evaluate which exercises were given. It was just, were exercises promoted in the video? So let's talk about some of the issues with these videos and why it matters. I'll link the research article down below so that way you can see all the videos that were included in this article. One of the big problems with these videos is based on their popularity, in that they're almost able to establish a standard of care that's expected and accepted when dealing with low back pain. For example, a couple of the videos would follow somebody through a first visit with a provider, and in that session they would get x-rays done for mechanical low back pain. But in the absence of any red flags, all of the clinical practice guidelines recommend against the routine use of imaging. But the problem is that if you're somebody who's dealing with low back pain and you're doing some research on your own online, you see these videos, you'll think that, well, if all these people are getting imaging, whether it's an x-ray or an MRI, well, if I'm dealing with low back pain, I need that too because that's just the standard of care. But we have research that shows that if we're looking at the transition from acute to chronic low back pain, that early imaging actually increases the risk of making that transition from acute to chronic low back pain. And then on top of that, we also have research that shows that early imaging doesn't actually produce better outcomes unless obviously there's a red flag, which the treatment is going to be a referral out. It's not going to be a conservative case. These videos also create an expectation of treatment. A lot of the videos have over-sensationalized titles such as chronic low back pain of 15 years cured with one chiropractic adjustment, or 3 powerful exercises to get rid of low back pain, or these are the best exercises to fix your back. And the problem is that a lot of those titles are unfounded. When looking at the overall effect sizes of spinal manipulation, we see that they produce similar outcomes as other recommended therapies such as exercise, but overall those effect sizes are actually pretty small. So having titles and promises that spinal manipulation will cure chronic low back pain produces an unrealistic expectation. Another issue is the promotion of the best exercise or the best treatment approach for low back pain. But when we look at the research, there doesn't appear to be a best exercise for low back pain. We see that core stabilization exercises perform just as well as walking, or strength training performs just as well as yoga. There's a lot of variability in how individuals respond to exercises. But the problem is that when we look at how search engines work or social media, of course you want the most effective or the best exercise. I don't want the second best exercise approach for low back pain. I want something that's effective that's going to help me with my pain. But a lot of these videos, they don't have any research or any data to support that they are the best or even effective exercises. They're just a title with random exercises assigned to it. And this gets to my final point, that a lot of these videos use outdated explanations for why somebody's experiencing low back pain. So for example, if we continue on with exercise, a lot of the videos would promote that a muscle tightness or a muscle weakness was the cause of someone's low back pain. But when we look at the research, majority of the time we're not able to isolate a specific tissue that's the cause of the low back pain. And that's because low back pain is multifactorial. There's a lot of different factors that contribute to low back pain. We do see some associations with low back pain. For example, those with chronic low back pain tend to have reduced back extensor endurance times, and those with low back pain also seem to have increased stiffness of the multifidus and the paraspinal muscles. But it's not clear if those actually need to change for somebody to reduce their low back pain. And frequently in the research, we actually see that strength doesn't seem to be the mediator for why people respond to exercise as treatment. And the whole problem with all of these ideas of isolating a specific tissue source as the cause of low back pain is that it kind of just neglects the whole biopsychosocial model for low back pain. And why does all of this matter? Well, a lot of people get their health information from online sources, so it's really important that we actually provide accurate and up-to-date information for these people, especially since none of this information online has to go through any filter. You can just post whatever with the title best exercise or best approach. There's videos out there that are promoting salty lemon water for the treatment of low back pain despite no research to support that it's helpful. So we really just need to make sure that we're providing accurate information and that it becomes more mainstream, some of the top hits on YouTube, so that way people are actually getting effective treatment for low back pain, which is the leading disability worldwide. So hopefully this video on online health information and low back pain was helpful. I know it was a little bit ranty, but honestly, it was one of the whole reasons why I started producing content online, was to provide accurate evidence-based health information for everybody to be able to access. So if this video was helpful, go ahead and give this video a big thumbs up. It helps with the algorithm, and so hopefully we can kind of help promote more evidence-based information online that way. If you want to support the channel, subscribe right over here. You can click the bell icon down below to be notified of future videos. I'll see you guys in the next video.